Hey everyone, my name is Lavonne and welcome back to my YouTube channel. This is part 2 where I am here with Dr. Amna Husain, and she is a IBCLC lactation specialist, counselor, and also a pediatrician. So we are going to have a super exciting conversation. If you haven't seen part 1, go over and see part 1. That is specific to COVID-19 vaccines, recommendations for pregnancy, labor, birth, postpartum, breastfeeding, into sort of a little bit of newborn stuff, but we're going to kind of move past that time frame today and discuss the same information related to kids. If you have followed me for a while, you know that I am kind of a pregnancy guru specialist into labor and birth. But once we hit kids, that's where we're going to start to kind of push them your direction. And so, which is also why I'm so grateful to have you here to be that expert and that pediatrician voice of reason that really balances the expert advice and the information, the evidence that's out there with being human. And that's what I think we found in the first chat that we had related to this kind of sensitive topic. And so we're going to talk about risks. We're going to talk about what to expect for kids. What are the recommendations? Vaccines we're going to get into, and some other questions along the way. So I'll let you introduce yourself one more time for those that have maybe missed the first time around. And then we're going to get into how you counsel families related to COVID-19, the pandemic, for their children.
Thanks so much for that, Sarah. My name is Dr. Amna Husain. I am a board certified pediatrician. I'm a lactation consultant. I own my own practice, but I think the most important hat I wear is mom. I am mom to 2 young little girls during this pandemic, so 4 and 6 months. So it's really important, I think, to hit on because they are both not vaccine eligible right now, which we will discuss as we talk further. But I'm also an AAP media spokesperson. So these are really common topics we discuss and talk about frequently. And I'm happy to be here answering any questions. A lot of the other questions that always come up that we even hit on in the first talk, you can find them on my TikTok, on my Instagram, and on my YouTube channel. But I am all game to answer any pediatric questions you have, because as you've mentioned, I think after having done this very recently, as I said, my second one is 6 months old. It is like almost easier when they're in you. You think it can't get any worse when you're at your most uncomfortable and you're like pregnant and you're like, oh my God, I want this baby out. But I swear to you, once they're out, it's like, I'm not even talking about the sleepless nights. It's just like, you're always thinking about how do I protect this being?
Yes.
Like they were very safe inside of you, but how do you keep them safe? How do you keep them healthy? And that is just like the first intro.
I love it.
Parenting. It's like a piece of your heart walking around. And here we are as parents in a pandemic. And I feel like we pediatricians have almost become like life coaches. Like, should I enroll my child in gymnastics? So let's look at the risk benefit. Like, when did this ever become such a difficult thing? You like have to put on your thinking cap to think of like your child can do swimming now.
Right. But that was never an issue.
Right. Like, should my child go see their grandparents? I don't know. Let me go talk to the pediatrician. It's so difficult.
Yeah.
And so I really want to acknowledge that, just like out the forefront, that holy crap, like parenting is hard just on one random week in January. And now here we are almost in our 3rd year of this pandemic. And we never thought that we would be doing this for so long. My husband and I actually had a moment where, recently, so we're filming this on, I think it's really important to mention, January 4th, 2022. So in December of 2021, we kind of got this like womp womp news that Pfizer was going to actually push out their trial a little bit more for young children. And my husband and I were kind of bummed because we thought, wow, after 1 year, we thought we would be able to get, at least our now 4-year-old vaccinated, but unfortunately that's not the case yet. And so I think we should talk about, Sarah, what are some of the common questions when it comes to COVID-19 in kids?
Well, I think I would love to start with just understanding, what does COVID-19 infection look like in kids, and based on different ages, because I think a lot of the media focus has been the immunocompromised, the elderly, adults, and that data on children has not been quite as prominent. Now we have a little more, and it's starting to be because of the vaccine trials and vaccines.
Right.
But what does it mean with COVID-19 if a child were to become infected? What are the risks involved with COVID-19?
Right. I think that's a good question. So going back to kind of what we mentioned in our first video, which you guys should definitely go check out if you haven't, we mostly geared that towards pregnant women, but I think it always comes down to breaking down what is COVID-19. So that is actually a disease, but the virus itself is a coronavirus. And a coronavirus is really a family of viruses. So the one that causes COVID-19 is called SARS-CoV-2, because, you know, that we have to name everything in science. So that's just who we are. But what does this virus typically cause? So this is typically a respiratory illness. It is spread by droplet transmission primarily, but it causes upper respiratory tract infection symptoms. So cough, runny nose, congestion. You can have a fever, you can have perhaps a headache. But those are some of the common symptoms that we see. Now, one really important sort of caveat to that to mention is MISC, or multi-inflammatory syndrome in children. So I will say primarily majority of children do have mostly an upper respiratory tract infection that can kind of look like the common cold or perhaps flu. Some children can get very sick, which can kind of almost resemble an RSV type picture where they're really having difficulty breathing, but mostly children do well. The risk is also a small minority might go on to develop MISC. And that is kind of the scary picture out there. And I think, you know, my brother-in-law is a physician and he does not do pediatrics, but he really pointed it out when it comes to the media. He was like, symptoms could be fever, stomach ache, low blood pressure, and cardiac arrest. And they were like, he was
That's
like,
helpful.
He's like, like, well, that sounds terrible.
Right.
And I was like, right. The media can be very scary when it comes to this. So let's talk about that a little bit. You know, I have videos on my channel that really break down what MISC is, but what we think it is that, well, actually kind of what we know now after seeing it almost for over a year, and really the first cases were in the UK, but now it's almost been present in every single state in the US, is that it really happens after the actual infection, about 4 to 6 weeks out. And we think it's an inflammatory response, not something where the body necessarily attacks itself. That's not really it, but it's really the cell messaging signals and proteins produced during an infection, which really ramp up the immune response. You see, the body's immune system can be amazing, but it also can cause some not so great symptoms like, you know, fevers, and perhaps, yes, you can have severe issues like cardiac issues. And that's really the thing that lands your child potentially in the hospital. And I think that's a scary thing that parents think of when MISC. I have a lot of physicians who are pediatric ICU doctors, and unfortunately, this is an illness that can be quite scary to see and can land your child in the hospital. Overall, children do well, but, you know, Sarah, it's hard to say, like, will your child do well with COVID? I don't know. Will your child do well with COVID? We just don't have a magic ball.
Yep.
And that's why I think it's really important for us as pediatricians that we've kind of been saying off, you know, the rooftops and trying to tell families is that children are not really insignificant. They're not little adults, and that we want to be able to protect them as well. They're an important part of society and an important part of community immunity. So we want to make sure that we can protect them the best we can. And that protection is going to look like hand washing. Luckily, you know, kids are taught that very early on. Kids are really taught that early on. Now, I will say it is so hard to try to keep their hands out of their mouth all those times. So just try your best to wash their hands. Sanitizer is a good second option, but hand washing is always going to be the gold standard. And then mask wearing if your child is over 2 years of age. So I think that's really important to point out. I think, yeah, I posted about this on my Instagram today, but there's so much decision fatigue and just anxiety that I have some parents who think, well, I should put a mask on my child too, my little baby, because that will keep them safe. But really, we recommend that under 2 years of age, you don't want to put a mask on your child. It's a suffocation risk. It's a strangulation risk. And even, yeah, it's really important to know that. I mean, I see some women who even like put those, I'm blanking on what the name is, but those like umbrella hats that you would wear with rain gear. That's clear. It almost looks like a visor face shield
kind of.
Yeah, they kind of wear it. I wouldn't recommend those things for children. So
That's important.
yes, does that make it very difficult to do things with children under 2 who can't wear a mask? Yeah, it
And
does.
are
I'm
into
not gonna
everything.
pretend it doesn't. So what can you do? You try to do more outdoor activities where transmission risks are lower. Yes, if your child were to potentially contract it, I hope it's not going to be severe, but you're trying to do your best here to keep them safe. Hand washing, mask wearing when age appropriate, distancing when you can. But those are the top 3 measures. And then lastly, vaccine, if they are vaccine eligible. And the vaccine eligible population right now is actually the youngest 5 years of age, which is really important to make note of. So 5 years of age, they can get the Pfizer vaccine. So anywhere really between 5 to 12 years of age, 5 to 17 years of age, they can get the Pfizer, and the Moderna vaccine is approved for 18 and up. So only Pfizer can do 12 to 17. These are like really detailed things that again makes it very difficult to be a pediatrician right now. I'm like,
sure.
You actually, nope, that one's actually not approved for kids yet. Nope, that one's actually not.
Right.
Even when it comes to boosters, as of January 4th right now are only now really getting approved for the 12 to 15 years of age. And I've had, some parents who were like, I want to get my 15-year-old boosted. And I'm like, well, actually, it's not approved yet.
Right.
So this is a very difficult time to practice parenting and practice pediatrics in, because things are changing and evolving so much.
Well, and I think that's important to say right now, because again, it's January 4th, 2022. And so we'll add some links under here for where you can sort of find some updated information. If you're watching this back, likely it's not going to change astronomically in the next while. But for you to find that information, it's important to know where to go. I have a question about boosters as like sort of a little bit of a derail since you brought that up. I think one of the things that I hear a lot, and I've gotten in like personal conversations about boosters with, is related to the like mistrust of the booster, because it's like, well, what if there's going to be another booster? In fact, I have somebody very close in my life that is, we've gone back and forth. I mentioned this offline, but like we've gone back and forth over and over again, because he's like, I don't want to get booster right now because there's just going to be another booster. And so what's the idea? Why does the booster help? And then sort of talk to me about, because I think that creates some mistrust in the booster.
Yeah.
Like, well, now there's another, like, did the last one not help me?
Right. And to answer that question, I always say, yeah, it did help you.
Yeah.
It did help you. And it still shows that they are working, but they help. We have very good data actually at this point. You just have to look at the curves and see hospitalizations amongst vaccinated people, and that vaccines prevent severe illness, they prevent hospitalization, and obviously the worst complication, death. But public health experts are starting to see reduced protection over time against mild to moderate disease, especially among certain populations. So you first saw this come out that immunocompromised and pregnant women, which we talked about in the first video, should be getting the booster. But now we see that actually the general public could definitely benefit from it. Look at how very, very easily Omicron is just transmitting to people.
Right.
I've had very cautious families throughout this entire pandemic who now are getting sick, because that's how transmissible it really is.
Yeah.
And so I want to tell families that boosters do just that. They boost your antibody levels. It doesn't mean that you're necessarily not fully vaccinated after 2 doses as of now, but this is the first time that people are seeing science unroll in front of them. This is the first time that we ever saw somebody get a shot on public television, and it was nationalized and sensationalized, but nobody ever looked and brought a camera in when somebody got their first rotavirus vaccine. So this is very different for the lay public to kind of digest and take in. But as pediatricians, I can tell you that there are 3 hepatitis B doses. When it comes to the Prevnar vaccine against pneumococcal pneumonia, we have, 4 to 5 doses. Diphtheria has 5 doses. Polio has 5. When it comes to the chickenpox, you actually get 2 doses of that. When it comes to MMR, you get 1 dose, and then you get a booster thereafter. So all these vaccines actually have boosters. And, think about the flu vaccine. We get that every single year. And there's actually a very good response from it. that even though the flu vaccine, we often talk about how effective the COVID vaccines are, and the numbers are in the 90s, which is excellent. But the flu vaccine is somewhere in the like 50 to 60% efficacious, but we have so many people get it that luckily we keep our flu numbers pretty low in the hospitals. And even then, you can see some elderly people pass away from flu. You can see children, about 150 to 200 kids pass away from complications of flu every year. And you just never thought about that. Now, in comparison, I want to tell you, that we've seen over 700 pediatric deaths, actually close to over 800 pediatric deaths at this point from COVID-19, which, it does make it a bigger deal and a bigger issue than the flu. And so I think that's one thing that's really important when people say, well, it's just the flu. Well, yes, children can get sick and some can get very sick. We don't have a crystal ball to know who's going to get the most sick. We don't have a crystal ball to know who's going to get, long-term COVID or brain fog from COVID, or who's going to have potentially a cardiac issue from COVID-19. I've seen some very young athletes who potentially have had, some cardiac complications, and then they just can't play football for that year. It's really not simple, unfortunately, to know. And I think that's really important to point out to families. And I really want to make sure we're not fear mongering here, but instead trying to say that kids are a really important part of society, and we want your kids to go back to a semblance of a normal childhood. I definitely want my kids to have a normal childhood. I still can't even go see my daughter swim on weekends because they only allow one parent. And so those are like little things that they're getting in the way of our parenting experience. And what's the best way out of this is vaccinating. So I think we've talked about sort of, what the infection can look like, what severe infection can look like, and what are some of the measures we can do. In terms of vaccination, I can tell you, Sarah, some of the most common questions I get is, how will this vaccine kind of help? And at this point, we know that vaccines have the power to stop epidemics. They do. And children make up a significant portion of the population. Even if your child does overall well, what if they go to visit grandma and grandpa? And unfortunately, if grandpa is 90 years old, and even though he's vaccinated, we want to make sure we can try to protect him, because that is the population that can potentially fall very severely ill, which we know of. So the dose of the vaccine has actually still been tested, same trials. And I think that's really important. We hit on this, but it's not really a matter of things being sped up, but really the red tape along the way, like getting enough funding, getting enough participants, having scientists across the world work together rather than one lab, in Philly trying to come up with one random vaccine. You actually had all the smartest brains come together and try to develop a vaccine. The participants were lining up around the corner. I still get DMs from families about how they can enroll their child into Moderna's trials or Pfizer's trials. And I think that's really, really amazing that we have this community come together to really serve science, versus many families may not even know about, the RSV vaccine trials that are being done. So it's not really that the vaccine was sped up. It's just that sort of the steps that take the longest, fundraising, etc., those were actually right there and kind of willing and at the ready. Another common question I get is, what are the long-term complications? And I want to make families very aware that we completely understand that children are not little adults. So many things in pediatrics are weight-based. So a lot of people will say, my child's really petite. Are you sure this dose is okay for them? But we actually test vaccines based on the age, not the weight. And that's so important to know, because it's almost very different from anything else we do in pediatrics. I dose Tylenol for babies based off of weight, and toddlers based off of weight. But when it comes to the vaccine, it actually goes by age, because as the immune system matures, it becomes a little weaker. Hence, you see elderly people get boosters all the time. It's because your immune system is weaker. And so the younger children actually get a smaller dose of the vaccine. And that's actually been tested for safety, tolerability, immunogenicity. And that's a really important component because we want the vaccine to not only just be safe, but to actually work. That's kind of where we are right now for kids who are sort of 6 months to 4 years of age. We thought the vaccine would come, but whoops, it's not showing us high enough responses to actually be immunogenic. And so that's really important for families to know, is that the product that's going to be put out for children is not only safe, but also something that's effective and keeps your child safe.
That's what they're looking for when they're doing the clinical trials. Safety for the kid, and then it actually being effective. If it's not effective, why do it in the first place?
Right, exactly. If it's not effective, we don't want to give your child a higher dose for any reason. We don't want to give your child too low of a dose. So it's really that Goldilocks moment where it has to be just right. And yes, it has to be just precise. So 2 doses may not be the case. Maybe it needs to be 3 doses. And that's really actually, it gives me confidence to know that it's not this, thrown together product that's just put out on the market. Right. No, actually, we want to test this to be absolutely safe. And in terms of safety, it's really the same for all vaccine trials. There's no really long-term side effects. I think that's a really scary term that gets thrown out there. It comes down to even the infertility thing. If I vaccinate my child, how do I know it's not going to affect her fertility in the future? Well, vaccines don't work that way. They're a blueprint in the body. It helps the body make the antibodies, and then it gets thrown away. It's a piece of protein that just gets degraded. And I really want to make that evident to families, is that really the only long-term effect is immunity. Now, short-term, usually you're going to see something if there's going to be a reaction, like immediately. For example, if it was an allergic reaction, to 2 to 3 weeks out. Most about 6 weeks. Thereafter, you don't really see something years out from a vaccine. And anybody who tells you so is essentially just fear mongering and really trying to perpetuate medical myths. And I want to make that really clear. We would never want to do something to harm children as pediatricians. And so that's
what
very
would you have seen as far as because I'm anticipating all of the DMs and the questions and the conversations that I've already had. I think the biggest concern I have heard, excuse me, is the fact that we're giving them something during their very susceptible developmental years. That they're growing and developing, versus like me as an adult, like my body is the size that it is, unless I gain some weight, like my brain's developed, I learn and I grow and whatever, but like my organs and my systems are kind of set. How do you normally respond to the fact that we're like introducing something during a more vulnerable developmental time frame?
Right. And I think it's a good question. I think you have to go back to how vaccines work.
Okay.
And every vaccine might be a little different. So hot topics and words thrown around right now are mRNA, viral vector, adjuvant, etc., things like that. Is there mercury in this vaccine? Well, luckily, all the ingredients are always thrown out into the CDC on the FDA label, so you can always read it. But the things that are in the vaccine, they help to promote immune response. And that immune response, the way the body will look at it, is you get almost like a mild inflammatory response, if you will. So you get the flu shot and you might get muscle aches and a fever. You don't actually get the cold. It's just that your body starts ramping up an immune response.
It's fighting the lack of infection, but like the new, we'll say cells, right? The vaccine introduced to say, I'm going to go get that. But in the process, I'm creating immunity.
Right. And I think it's really important that the virus that gets introduced, let's take the flu, for example, it's a killed virus. So we never introduce live, for example, virus in without knowing the risks. For example, in the MMR vaccine, we know that this is a live vaccine. Well, guess what? That's why it's given at this certain age. Yeah. So for example, it's usually given somewhere between 9 to 12 months of age. And we know data about when this should be introduced. We know about when an immunocompromised child should be getting this kind of vaccine. So with the COVID vaccines, there is no live viral component. You cannot get COVID from the virus. You can absolutely get muscle aches, pain at the injection site. You can have redness at the injection site. You can have headache. You can have chills, which again, all fall under an inflammatory response. Inflammatory response doesn't feel good. It means that your body is ramping up and trying to produce antibodies and fight whatever this infection would be. And it sees a blueprint, knows that the next time I see something like this, I know how I'm going to defend myself. But the blueprint, it gets thrown away. It's really amazing how our body kind of contains that long shelf memory. Now, I actually, going back to your first question about can we give it to a child this young? Well, we have great data to show that the immune system actually responds very nicely when they're young, that we can actually be able to introduce a small amount of the vaccine and not, as I've said, the immune system kind of fades in strength as we get older, which is why you see elderly citizens needing their pneumovax, et cetera, and why we always push them to get their flu shot. We know that their immune system is very strong. And we also know that children are very susceptible to passing infections back and forth and back and forth. So we can protect them against these childhood diseases that, Sarah, like we always say in Public Health 101 is that vaccines are almost their own worst enemy. They're their best campaign. They have done such a good job eradicating these diseases that we are like, do we really see them? But, when have you ever lived through a pandemic? So I've never. So this is our chance to really vaccinate a population because children are a huge part of community immunity. And I want to make it clear that not only is it your chance to protect your child, but also your chance to really protect your child when they visit their grandparents, or if you are pregnant and this is your chance to protect your toddler who might be going to school, and potentially, and around other transmissive risks.
I love that. So as far as risks for vaccine, it's really that localized you mentioned, and then if there was going to be a complication with the vaccine, because again, that to me is what I hear constantly is like, somebody hearing something about blood clots as a result of somebody that got vaccinated or whatever. If you're going to see a reaction, you're seeing it within the first, immediately or in the first 6 weeks. Is there anything else that people should be aware of when they're considering vaccinating their kids?
Yeah, I think there's a couple of things that we can definitely talk about. So in terms of when this vaccine first came out, people said, and back into December 2020, that you should not be getting any vaccine within 2 weeks of getting the COVID vaccine. But that is very outdated now at this point. That's how fast science evolves. Like you can absolutely get your child, their other childhood vaccines, like let's say HPV and their COVID vaccine the same day. But the flu vaccine and the COVID vaccine, they can all be given at the same time. We recommend, different arms so that you can, you're going to be sore in this arm and sore in this arm, but you'll get through it just fine. But we do recommend different arms, but you can absolutely get it on the same day. Now, one thing, I think it's really important to point out is people are definitely going to ask about myocarditis. What is myocarditis? It's actually an inflammation of the heart muscle, and not just myocarditis, but pericarditis, which is an inflammation of the outer lining of the heart. And people really learned this term after the Pfizer vaccine for children aged 12 to 17. We did see some myocarditis cases, which were rare and not fatal at all. But yes, there was absolutely noted, and they were always noted in generally adolescents aged 12 to 17 and usually males. Now, we actually noticed none of these cases at all in children 5 to 11 in the trials, but we're going to continue to monitor for that. One thing that is very important to point out, though, is it's actually way more rare, and your risk of getting myocarditis from COVID infection is actually 6 times higher if you actually get the infection. And it's not always, not fatal. Unfortunately, there can be a lot of complications. We talked about MISC, but I think that's very important to point out because that's a common question I get on TikTok, on Instagram, that I want to get my child vaccinated, but how do I know they won't develop myocarditis? Well, it's really, really rare, like very rare to see. We do know the types of people who will get it. It'll usually be young adolescent males, but we are able to monitor them pretty easily. It's symptomatic management, which you and I both know in our medical talk means, you kind of just do nothing. You hook them up to a monitor. You might give them some fluids. You just want to make sure they develop, no complications, that they overall do okay.
Runs its course.
Yes, we do see this. It is, again, part of sort of the inflammatory immune response. But luckily we aren't seeing it in children really 5 to 11 in the trials, and haven't seen too many real life cases of it either. One common thing I've seen is that people think that their baby might adversely react when they get the vaccine and they're nursing. They think they see ulcers on the roof of the mouth.
Oh,
have you heard this one? Yes.
No.
This is medical misinformation at its finest.
Okay.
I have heard this one. I have heard also babies developing clotting abnormalities. I want everybody to be assured that if this was something we saw, we would be blasting it on the news. Nobody would be keeping it under wraps. We as pediatricians want your child to do well. We want your child to be healthy.
Avoid blood clots and ulcers.
Right. We would not be covering up mouth ulcers. We would not be covering up anything of the sort. If anything, I have so many stories of vaccines that we noted were causing XYZ and were pulled off the market or things like that. So these are very closely monitored and regulated. And I think it's very important that if you have questions, you should go to your pediatrician. One thing I want to make clear though, and we talked about this in our first video, is that if you are being told something different than necessarily what's being recommended by evidence-based medicine, by the American Academy of Pediatrics or the CDC, and your pediatrician is not giving you answers that are up to date, please get a second opinion. Anybody who's kind of minimizing your thoughts or minimizing your worries, that's not the pediatrician for you.
And their job is to answer your questions, give you the evidence, and help reassure you to help you come to a comfortable decision that's safe.
Right. And I will definitely say, and this is my first time really saying it publicly ever on social media, but I have been the parent in the situation where a pediatrician I knew, because I was a doctor, was really giving me like incorrect data on the vaccine and really guiding me, away from potentially vaccinating my child during this pandemic against COVID-19. And I had to have a very blatant, blunt, that's me, that I was like, you're against evidence-based guidelines right now. I don't care what you think or what your little study might be in your practice, but this is what we know. This is the number of kids who get sick. These are the number of kids who can develop complications. And comparing this to flu, we know that unfortunately this has been something that has upended children's lives, which I don't think we talked about when it comes to sports or school. How do you really handle that with kids?
And balancing the fact that you want them to have a childhood. You want them to not only know being locked in their house away from everybody and never interacting or anything like that. So what do you recommend for balancing that, lifestyle choices?
Right. So luckily I live in New Jersey where it's cold as anything right now in January. So what are we doing outdoors? Absolutely nothing. That means that we have to make a lot of choices. And this is how I kind of talk to my families, is that, hey, this is me. Nowhere in my pediatric residency did they pull me aside and say, when the pandemic comes, this is the advice you're going to give your parent. So we are all learning as we go. And sometimes I am teaching families based off of my example. So I have one child who can wear a mask very well. During this time, during the surge, I have upgraded her from cloth masks to a high grade mask. That means a KF94 or an N95. And that's what she's going to school in. Luckily, when we looked at her schools, I definitely asked about the teachers' vaccination status. I asked about what their vaccine policies were generally. I want kids to be vaccinated for flu too. I want the kids to be getting their childhood immunizations. I don't want somebody spreading measles as well when I have a newborn in my house. So those are good questions to ask when you have a young child. You want to know kind of how seriously these schools are taking it. Now, many schools try to do the best they can and get most activities outdoors. But if you're in a place like mine where you're not able to, then what do they do indoors? When they take their masks off, are they sitting far apart as best as they can? What if there's a positive case? Because Omicron is going to happen. We are seeing positive cases. What can we do? What does the school do? And I think those are all very good questions to ask. So at this time, I think it's really important to point this out on January 4th with the recent CDC guidelines that, after day 5, you can go out, but you have to wear a mask. And I really have to caution families there that the K through 12 guidelines as of January 4th have not changed. It is still 10 days because guess what? Kids are taking their masks on and off. So day 5 to 10, they are not diligently wearing their masks. So you really need to be, very frank with families. And I have had some very difficult conversations in the last 4 weeks. I feel like I prematurely aged even more during this.
I know, all of us have.
But these some very difficult conversations that you have to have. And testing, if somebody gets sick, are they testing out? Are they testing and staying at home? What is the policy? Are they virtual schooling? Now, as your child gets older, we talked about this, but the Swiss cheese model a little bit. And so you have, lockers potentially separated out and you get, smaller locker breaks. Now, I remember when I was in grade school, it was like this tidal wave during class change. It was just packed. Well, we're actually not doing that very much anymore. You're having a very separated sort of single file way of directional flow of traffic. Masks are going to be on. And luckily, as children get older, they're better and better at keeping their masks on. Now, we're getting into a point where it gets hairy, where some states may not mandate a mask, or some states, school systems have only stuck to day, after day 5, you can come back. And I want to just make it really clear to parents that I get it. I see you. We're all trying to navigate where you have governors trying to get their hands into the science and parents trying to go back to their jobs and kids just want to be back in school. And this is just so difficult. And
and especially when things are changing, I think the lack of concrete, by concrete, I mean consistent data. And then something else. And now, wait, what's the new recommendation? And wait, now my kid can get vaccinated. And now I'm not supposed to wear a mask. I'm supposed to wear a mask. I think that can get really confusing for families.
Sure. And that was one thing that, let's go back to May 2021 when the CDC said everybody who's vaccinated can take off their mask. And then, you're asking people to do the right thing and tell the truth, but that's not going to happen, unfortunately. And so we have to, I always hit back to parents is that, hey, I had 2 kids who were not vaccinated at that point. So I never took off my mask. And here we are, where we're seeing surges, and you kind of have to figure out what's the comfortable risk for you. And this is the really tough thing I really spoke up about recently, is that you're either told you're overreacting or you're underreacting. Or it's a conspiracy theory, etc. And we all want our kids' lives to go back to normal, but unfortunately, we're not there yet, and we are taking steps. So what's next on the horizon? We do plan to see that hopefully by March, we should be seeing a vaccine for children 4 years of age and under, hopefully by Pfizer. But we're not there yet. So what can you continue to do? I want you to know that you can continue to mask up. Your child, when they're 2 years of age and up, get a high quality mask at this time. I would not do a cloth mask if you could. There are some great KN94s that are, I've gotten my child's off of Amazon, and I've posted them on my Instagram highlights that what masks we use. We also recommend hand washing when you can. Try to stay outdoors if you're in a nice place like California, but if you're in a cold place like me, takeout might be the best thing to do. Trying to sit at home if you can. If you travel, car would be the safest. Obviously, there are some things that are just not practical. You cannot fly overseas in a car. And perhaps if you have young children, it's just not practical for you. So you fly. Try to do your best to keep them, overall in a flight. The air circulates very well. So airports are the biggest risk. So try to, practice the best mask wearing and hand hygiene you can at that time. But one thing I really want to make clear is that you can do everything, Sarah, and you still get Omicron, or your child gets COVID-19. And that is not like the scarlet letter. don't let that like keep you down. That doesn't mean you failed. If that was the case, then I failed back in, November 2020 when I got it and gave it to my toddler daughter. And you didn't fail. This happens. Let your pediatrician know. We will give you red flags to look out for, and do not be afraid to seek higher levels of care like the ER if you see your child getting sicker. But this does not mean that this is a poor reflection on you as a parent.
Yeah, I love that message.
No,
and I feel like, especially, it can feel really discouraging when you're like, I did all the things. Like I did everything right and I still got sick, which does happen,
Yeah.
So that's where it's that accountability. And also, like, this reminds me of what I tell nurses when I train labor and delivery nurses, because they can walk away and obsess about, well, this didn't go the way that I wanted, or they had a C-section when they really wanted a vaginal birth or whatever. And I think the question is, did you do everything within your power to give them the best care? And really that applies here too, of like, did you do what you could, and if the answer is yes, then you did everything you could. And that's where there's so much grace. And even if you didn't do it, then it's like, well, all right, lesson learned, that next time I may do something different. And that's life, right? That's navigating all of our decisions as we try to figure out how to be humans.
Right. And, things are just very unpredictable. I've had families come into my practice where the parents are not vaccinated and they decide not to get their child who is vaccine eligible. They refuse the vaccine. And then unfortunately, father falls ill, healthy father who ends up getting complications. And that is unfortunately what tips, the iceberg. It changes their mind. And then mom gets vaccinated and child gets vaccinated. And it's terrible that it has to happen that way, but I'm just glad that they're able to provide their child that protection. So don't blame yourselves if that happens. What matters is we learn, we get better, we do our best. Parenting in a pandemic was never anything somebody pointed out to me. Literally, as with life publicly on social media, I have faced all sorts of criticism trying to raise my kids and navigate this.
Yeah.
You're doing your best. That means you have to have some very difficult conversations with potentially loved ones. You might even be like ridiculed for some of the questions I know I was when I was interviewing schools, like, why are you asking about the teacher's vaccine status? Well, I mean, I'm sure, Sarah, you've had that happen too, where moms want to know about their nurses' vaccination status.
Absolutely. Whoever's coming into their house. I get asked regularly.
Yeah.
I've actually, and more than asked, I've like, people ask for proof. Like they actually want to see it, which great.
Yeah, absolutely. And I think that that's very important. I mean, we talked about a lot today. We talked about what COVID-19 can look like, what severe COVID-19 disease can look like, MISC, which is just another animal altogether. And we want to hopefully prevent that from happening in children. But it is a very real disease. And we do see it affecting more children than we see, the flu, which you'll often see thrown out and minimized.
Right.
The vaccine itself, that data is changing, and not necessarily in a bad way where we're retracting it and pulling it off the market. In fact, it's in a good way. We're seeing more and more children become eligible for it. And we know that if you're 16 years and up, you can absolutely get boosted as well. We talked about this, but hopefully even 12 to 15-year-olds will be getting approved for their booster, hopefully within the next coming weeks. But as data continues to evolve, and we hopefully will get, children 4 years of age and under approved, you guys, I will definitely keep you posted on that.
And they can follow you and that information, those updates where?
So there's, I'm kind of on a couple of different platforms. So here on YouTube, you can find me at Dr. Amna Husain. Actually, when the vaccine was approved for adolescents and young children, I had a new video come up that day. So it has all up-to-date actually data on it that's still applicable today. You can find me on Instagram at Dr. Husain, and on TikTok at Dr. Amna Husain. So Dr. Amna Husain.
I love it. Well, thank you so much for your time, for your expertise, for having these conversations. I feel like I definitely learned some little snippets that I'm going to take into my practice with my clients, with my followers, and all of that. Guys, make sure you follow her down below. I'll link everything in the description box down below, including some really helpful resources as we all kind of continue to navigate this pandemic and these decisions. keep your heads up. We want to remind you that we're all doing the best we can. We are all in this together, and really it's going to take a team effort in order for us to sort of end up on the other side and resume some sense of normalcy into the future.
Right.
So with that, I'm going to say goodbye for now. If you have any other video ideas for Amna and if you have any other conversations, you can let her know on her platforms or comment down below and let us know what you want to see, and we can have her back for other future conversations from our pediatrician expert here. And then until next time, don't forget to flex and flow, and we will see you soon. Bye.